it took me a little bit to comprehend, what all this meant and what an honor it is. But it puts me in a different bracket as far as being a selected as William Dodd Award winner. Um, I'm very honored, first of all. It's I was without words for the longest time, just trying to figure out, try to absorb all of this. But I'm certainly in a different category. It's very honorable and very overwhelming to be recognized by PALTmed and be one of the few that are selected for this very prestigious award. So I'm very honored and very privileged and very, very grateful. Been a member probably since the late 80s, or late 90s rather, 96, 97. Um, a number of things. Probably the most valuable asset to the organization that I've been able to take advantage of is the relationships. The working with colleagues and providers, doctors that do what I do every day. Um, I believe we're an elite group of people, all of us. We do special care for special patients, and I don't know that everybody can just walk in and do what we do. And I think that having the value of all the brains, if you will, in the organization that um, share their knowledge, share their experience. The camaraderie is amazing, and the support that we get and give. But I've received over the years in the organization is immeasurable. And so I think one of the probably most valuable assets is that the camaraderie, the information, the learning, the support I get from the colleagues that I have in the organization, and there are many. It was an honor to be president of the Ohio chapter as well. And and actually I was president during the pandemic, which made it a little more challenging, but also a little more interesting. But I think that the work that PaltMed, formerly AMDA, does in general it trickles down to the state chapters. And I think it's important for us as leadership at the state level to take the information and the work that they're doing at the national level and bring it to the state level. Sometimes it doesn't always trickle down as it should, as unless we do that. Our members value very much the information we bring from the national chapter. And I think we have a pretty strong representation from a state level at the national level. So I think that goes both ways. So the other half of that equation is what Ohio or what our state chapter brings back to the national organization as well. So I think that, sort of back and forth, sharing of information, sharing of ideas, sharing of best practices benefits the local chapter, the Ohio chapter, in this case, Ohio, but also I think it does provide some value to the national organization. Additionally, there are a lot of talented people in both organizations, and uh, not unique to Ohio either. So I think when we understand what's going on at the national level, it gives us an opportunity to take what we love and take the information that we have and the work that we do back to the national level and contribute to the organization in that way also. So it goes both ways. I would ask him, what is the difference from today compared to what he saw and felt was important back in when he was a leadership and leading the organization, AMDA, back then. It'd be interesting to see how things have changed and yet how many things are the same. So I think that's probably the first thing I'd ask. So can you compare and what are the differences and what are the likenesses between AMDA back then and PultMed today? Uh, Thanking once again the nominating committee, the board of directors, and well as all of the and the person that nominated me for this award and provided all the support. but also just thank the organization for the opportunity to be a member and also to contribute at the levels I've been able to contribute at. Um, it's no small task to be a part of the organization, and I think that some of the contributions that I've made, I think, have been valuable, but I've learned so much and derived so much from my membership at PALTmed, and I'm very grateful for all the opportunities and the learning, and it's made me a better doctor, and I really appreciate that. So thank you again for the opportunity, and thank you very, very much for the recognition and the Dodd Award.